welcome to our new session, which is what's new in Obs and Gynae. Now what we'll be discussing here is, we'll be discussing what are the new guidelines coming up in our field of Obs and Gynae and any updated version of the old guidelines. So we'll be discussing only important guidelines here. It is important because anything which has been changed in the universally used guideline is a very potential question. Okay, so if you want to mark a correct answer, you have to be very updated for the guidelines. Today we'll be discussing very important, that is cervical cancer screening guideline. A cervical cancer screening guideline is very important topic, right? So we'll discuss what and how it has been changed in the new guidelines. New, I mean, the changes have been there in past 1 to 2 years. So the guidelines we have been using for cervical cancer screening is the American Cancer Guideline. So ACS provide the guidelines for cervical cancer screening. First guideline was provided in 2012, which we have been following up till now. But now new guideline has been given in 2020. So let's see what are the changes. Any screening guideline is studied in 3 steps. When do we initiate? How do we follow? And when do we stop? Okay, so what up till now we have been doing? So cervical cancer screening was started at age of 21 years. That was the old version, right? And how were we following it? So we start screening at 21 years using pap smear, and from 21 to 29 years, in younger age group, the pap test is the primary test for screening. HPV was not even mentioned in this age group. After 30 years, pap is again the primary test, but if you do not have pap facility, you can go for HPV also as your second option. So first option was pap again in this age group, but still HPV can be done only after 30 years. So this was the older version which we have been doing up till now. And when do we stop? We stop at 65 years of age if all the reports have been normal. But now new guidelines have changed everything. When do we initiate? We initiate at 25 years. So this is very important that you now don't screen women from 21 years, you screen from 25 years. Then how do you follow? Now the primary test which is offered in everyone who is more than 25. Now there is no differentiation between less than 30 and more than 30. Everyone who is more than 25, the primary test offered is HPV. Okay, so this is your first option always. If your center does not have HPV, you can go for pap smear. Okay, pap smear or liquid based cytology, any of the cytology test. And if your center is a very good center, it has both, you can go for co-test also. Co-test is both HPV and pap. This is the third option because it is a costly one. India is a very cost sensitive population. We do not offer the costly test as the first option. So HPV is the first option now, and second is cytology. Everyone more than 25. Okay. And when do we stop? It is still the same. We stop at 65 years if everything has been normal. Now, pap is very specific, but it's a less sensitive test. So whenever you are doing pap, you have to repeat every 3 years. Here also, if you are choosing the second option, if you are doing pap smear or liquid based cytology, you have to repeat every 3 years. HPV is a very sensitive test, so you don't need to repeat that frequently. And if a woman has got HPV, you have to repeat it every 5 years. So this is the new guideline. Now, important is why these changes have been introduced. So I'm not telling you why the changes have been introduced because it is important for a question. Basically, my experience has been that if something has been changed or something new has come up, if you know the story behind that, why it has happened, it is easy to remember, right? So why the changes have occurred, why they have changed the age from 21 to 25. So these guidelines are being formulated in America. So there, the vaccination has been rampant. So HPV vaccination has been rampant since 10 years. Now what has been seen that vaccination age is 11 years. So every girl, majority of girls which have been vaccinated 10 years back, they all are now falling into the age group of 21 years. So now the girls which have been so widely being vaccinated, they fall in this age group. And if you test for HPV in this age group, which have already been vaccinated, it is useless. You will not find anything. So now they have updated the age to 25 because this age group is already vaccinated and you will not find anything. That is why you do not need to test this 21 year girl. You need to test from 25 years. Okay. Now Previously it was Pap test, but now HPV. Why? HPV has always been a very sensitive test since it has been formed, but it was under trial. It was not FIGO approved. That is why the Pap was still being applied. Whereas Pap is only 50% sensitive. Then also HPV was not approved. But now all the trials have been completed. That is why the HPV is now the primary test for cancer screening rather than Pap smear. Okay, that is why these two changes have been introduced. Now HPV has been confirmed to be safe and sensitive, and because the ladies have been vaccinated so widely, so that is why the age group has been upgraded. Now vaccination is still being continuing, so maybe 4 or 5 years down the lane this age might change again and you might need to learn about the new guidelines. So this is the guideline which has been changed of 2020, which you should remember, and the reason why it has been changed. I hope it was helpful for you. For any new guideline change, switch to my next videos. Thank you.